Many women fear the arrival of labor contractions due to the uncertainties that arise during pregnancy. How do labor contractions start? Will I recognize them? Where does it hurt? Should they be regular? When should I go to the hospital? In this AllForBabies video, we will answer all your questions. Let's get started. Labor contractions. Labor is a physiological process through which the baby makes its way through the uterine canal. For this, the cervix must gradually dilate until it reaches 10 centimeters in diameter, so that the baby's head has enough space to descend. This process can start weeks before giving birth, but it will culminate with the famous labor contractions. Therefore, contractions are essential for a natural delivery, as it allows the baby to exit through the vaginal route. Braxton Hicks contractions. Not all contractions in a pregnant woman are labor contractions. There are other less-known contractions called Braxton Hicks contractions. This type of contractions do not pose any risk nor indicate that labor is near. Their function is to prepare the woman's body for the moment of delivery and may occur from the second trimester of pregnancy, although they tend to occur more frequently in the last stage of pregnancy. If you want to know how to differentiate Braxton Hicks contractions from labor contractions, you should pay attention to the following signs. They are irregular contractions. They disappear with a hot shower or rest. The belly becomes hard. They are completely painless. Therefore, if you notice that the belly hardens but you feel no pain or it stops with a nap, you can be at ease. What do labor contractions feel like? Although sensations may vary in each person and in each pregnancy, there are some generalities. At the beginning, labor contractions may feel mild. The first ones are like menstrual cramps or similar, although it is difficult to describe the pain. Contractions start as mild, short, and spaced over time. Gradually, they become longer and more frequent, occurring regularly. The intensity will also increase as the moment of delivery approaches. The pain of contractions is felt in the abdomen, belly, and kidneys. Breathing, relaxation exercises, connection with your body, and some local anesthetics, such as epidural, can significantly reduce these pains. When to go to the hospital? In the last weeks of gestation, especially from week 37 onwards, you may start to feel painful contractions indicating that labor is near. However, if you rush to go to the hospital, you risk being sent back home because it may only be false contractions. To really know if you should go to the hospital, check the following. Contractions are regular, meaning they follow more or less the same pattern. If contractions occur every 3 or 4 minutes for 1 hour, it's time to go to the hospital. At first, they will be more spaced out, and gradually, they will increase in intensity and duration while decreasing the time between contractions. The belly becomes hard. Along with pain, the belly will become very hard and tense, disappearing once the contraction is over. Contractions are painful. They will start with little pain, and as labor progresses, they will increase in intensity. Also, if your water breaks, it means you are starting to lose amniotic fluid, and you should go to the hospital. Contractions may start immediately or in the hours following. Finally, you should know that any bleeding during pregnancy should be evaluated by a doctor. There are times when a pregnant woman may experience painful irregular contractions for days or even a couple of weeks before labor. This period of prodromes or pre-labor contractions varies widely from one woman to another and from one delivery to another. But when you are in labor, you will not doubt it. See you in the next AllForBabies video.